Hello, and welcome to the Stem Cell Healing Institute podcast. In case you have any questions regarding this program, please write us at info@stemcellhealinginstitute.com. Thank you and enjoy the podcast. Hello and welcome to the Stem Cell Healing Institute podcast. We are here with Dr. Sara Figueredo. She is the director of the institute and she is here with us tonight. And we're gonna talk about autism and how stem cells can benefit patients with autism. Hello, doctor. How you doing tonight?
Hi, Luis. Very good. Thank you so much. And thank you so much for having me.
Doctor, we see a lot of cases of autism out there, and we were wondering how can stem cells help these patients?
Yes. We see a lot, and the numbers are growing. We haven't concluded conventionally whether it's nature or nurture or a combination of both that results in autism. However, from my experience, what I've noticed is that there is some sort of predisposition, and then if the key fits with some other environmental factors, autism results. So there might be some predisposing factors. However, autism doesn't manifest if those environmental factors don't exist. And in other cases, those the predispositions are there and the environmental factors are thrown into it, and that's when autism results. So that's one thing, and we're society has been puzzled as to why the numbers are growing quite exponentially, and that's one of my theories, and I think it's a combination of various things. Vaccines, it can or cannot be sometimes the vaccines or other environmental toxins, pesticides, things like that. So that's something that is still controversial. However, it is something to discuss. So yes, how do stem cells, in answering your question directly, how do stem cells help autism? Well, what we've seen in our practice in the way that we treat autism, and because our treatment is so comprehensive, we combine the best of nutrition and nutritional supplements and certain key dietary changes, as well as oxygen therapy and detoxification is so important, as well as the key stem cells and the number of viable stem cells. That is so important. And then, of course, key minerals. In autism, we find that diet is a huge factor, as well as key nutrients that many autistic children are deficient in across the board. Things like vitamin D, vitamin B12, magnesium, omega-3s, certain key fatty acids, essential fatty acids. Those are just, and probiotics, those are just a few of the vitamins and minerals that autistic children are lacking in. And then things like dietary factors like gluten and dairy and artificial colors and flavors and preservatives, and those can all be triggers. So it's really important to address those as well as all the other aspects of the treatment itself. So, and as I've said in the past, our motto is to leave no stones unturned. So anything that's going to help, we will do it.
I see you mentioned autistic children, but there are also autistic adults. Can we treat adults also?
You know what? We can. With adults, it becomes a little bit more difficult because it's, as the younger they are, the more plastic their brains are, and the more think of a piece of fresh plasticine. It's pliable, it's workable, it's moldable, but as it gets older, it becomes harder and more difficult to mold. And it's the same idea with autism. The older the person with autism, it's more of a hit or miss. It can help, we perhaps not to the degree that it could if they're younger. So we try to treat children as early as possible, um, so that they're the most vulnerable in that sense, and their brains are more plastic, so they respond in a very, very positive way. You asked me how what kind of changes possibly we could see, or how do stem cells help? Well, stem cells help. There is no actual cause, or nobody has found anything wrong per se in the brain of a child with autism. Okay, so if you do an MRI, if you do a CT scan, everything looks very normal. So we call this neurodiversity, which it is the norm for this type of a person. Okay, so it's more about accepting that difference. Okay, so a neurodiverse, and so there's nothing essentially wrong with a person or a child with autism. However, it's just the way that society operates in the social interactions, and what we eat, the foods we eat, and how you interact emotionally with someone else, with the inner and interpersonal social skills, and things like that. That is where a child with autism has difficulty, and that's what we try to help with, so that a child can literally cope in life in normal society, um, and have a normal, healthy quality of life, and grow up and get married and have children and have normal, healthy relationships. And that's what it really essentially comes down to. We're not trying to fix a wrong, because in a child with autism, we call it, and as I said, the neurodiversity is not a wrong that we're trying to fix. We're just trying to enhance and better the quality of life. So it would be in those different aspects, social interactions, and transitions. We see children with autism have difficulty with transitioning, moving from one activity to another. They don't like change, and so the stem cells help with that. They help with behavioral modification, help with the social interactions, the ability to make friends, eating a diversity of foods. We had a child that, after a few months of treatment, he told his mother for the first time, a 5-year-old child told his mother for the first time, "I love you, mommy." And the
Wow,
mother
yeah,
called us
that I heard that
tears.
story before, and it's so amazing. I mean, this is the second time I hear it, and it's still it really gives me chills when I hear it.
Yes, I know. It's very touching. She was ecstatic. She called us up in tears, telling us what
Wow.
happened, and we were actually very quite pleasantly surprised that it was so quick, and he started to eat different foods. Before that, he ate no more than 5 different foods, chicken nuggets, and I can't remember exactly what the 5 foods, but I remember
Yeah.
chicken nuggets was on that list, and and nothing else. But after that, he started to eat more vegetables, and the mom is a very healthy mom. She tries to do all the colors of the rainbow, so all the vegetables and fruits, and he was starting to eat a variety of foods, and so it was very, very, very
What would
positive. He was
you
very happy.
say is the proper age for kids to come and have the treatment done?
That is a very good question, Louise. We take children as early as 3 years old up to 12 years, and that would be the ideal age. That would be the ideal age, anywhere between 3 and 12.
This treatment, how long would it last?
So when a patient comes to Guatemala, which is where we do our treatments, because the FDA doesn't allow treatments like this in the U.S. Or Canada, but for that matter, um, they would come for 7 to 10 days. The treatment itself, like all the pre-treatment and post-treatment, lasts about 3 months. Okay, so they start the pre-treatment protocol with diet and supplements and things like that, and then all the way till the end of it's 3 months, but they're only in Guatemala for 7 to 10 days, where we accomplish all of the detox, the nutritional IV of detox, as well as suppository and B shots, B complex injections, And then we do oxygen, exercise with oxygen therapy and mineral and herbal therapies, our stem cell enhancement formula. And then, of course, the stem cell treatment itself. That all takes place in Guatemala.
We can manage all the travel arrangements, and we can even provide a chauffeur, right?
Absolutely. We make it very, very accessible for prospective patients to come, and we have a chauffeur and airport transfer service, as well as the chauffeur that a driver, personal driver that takes them to and from appointments. And we arrange for accommodations as well, a nice, comfortable two-bedroom apartment, and just with all the comforts of home. And we also help with finding flights and with itineraries and things like that. So we
That's
try to make it
great.
as simple as possible.
It's an all-inclusive treatment.
Yes,
And
that's right.
Guatemala has so many places that you can visit also.
Yes, that's a really good point, Luis. That's a really good point because it's a beautiful destination spot. We have so many, volcanoes that you can, volcanoes and the coffee farms and ruins, the Mayan ruins, and it's beautiful
Let's not
nature,
forget
and
Antigua, Guatemala, which is World Heritage City.
that's absolutely unique. Exactly, Antigua, which is a UNESCO
World
World
Heritage.
Historic Site.
Yeah. Well, I suppose they can write you. They can send an email in case they have any inquiries.
Absolutely. Yep. They can reach us at info@stemcellhealinginstitute.com. And they can also visit us on Facebook and Instagram. And they can call us also directly. The US number is 209-690-7836. That's 209-690-7836. And the local Central American Guatemalan number is 502-4220-7297. That's 502-4220-7297.
And you can find us also on YouTube, where this podcast is placed on a video format. And you can also find us on Facebook and Instagram.
That's right. Thank you so much, Luis.
All right. Anything else you would like to add, Doctor, to this podcast?
Nope. I think that we've covered a lot, and I'm happy to take any questions and queries from listeners by email and so on and so forth.
All right, Doctor. It was nice having you on the podcast once again.
Thank you so much, Luis. Thank you for having me. It's always a pleasure.
You have a good night.
You too.